Hello, hello. It's Wellness Wednesday. I'm Dr. LaJoyce Brookshire, and welcome to Ask the Good Doctor Live. We are here today with a wonderful program to teach you how to attain, maintain, and reclaim your perfect health. So get your Good Doctor notebook. You are not going to want to miss one moment of this educational session today. I mean, this is going to be action-packed. We are gifted with the presence of Dr. Blanch Grube. She is the author of Chew on This, But Don't Swallow. She is a holistic dentist. And I'm sure by now you're asking, what in the world is a holistic dentist? Well, we'll let you tell you all about it. Welcome, Dr. Blanch. Thank you so much for joining us.
Thank you very much, Dr. LaJoyce. This is a pleasure.
Indeed, it is. And we have just discovered that we're in each other's backyards. I'm in the Poconos and she's in Scranton.
Yeah. Actually, I live in the Poconos.
Okay.
I'm literally in your backyard.
Literally. All right. We'll talk later about that.
Okay.
I have found this to be the most comprehensive read ever on dentistry, modern dentistry, and its dangers. And I studied with Dr. Fred Burton, who is my mentor, an alternative therapy doctor, as well as a medical doctor. And he always says, if you want to find the answers, look in the mouth.
Right.
Would you concur?
That is correct. The first time I heard Dr. Hal Huggins say 95% of all diseases start in the mouth. And at the time, I thought, this man is crazy. That can't possibly be true. And after 40 years, I have to tell you, he was wrong. It's 97%. 97% of all problems start in the mouth.
Wow.
People, we are just not educated enough as to the importance of keeping your teeth healthy for the rest of your life.
Yes.
We just can't say it enough, and people do not know it. They think that dental disease is sort of a rite of passage. It's something that happens to you as you get older, like aches and pains. Oh, I'm just old. Problems with your eyesight. Oh, I'm just getting older. All kinds of things. You're losing a tooth. Oh, I'm just getting older. There are people who actually believe you lose a tooth for each pregnancy. That is the most bizarre thing I've ever heard. It is bizarre. And the truth is, I think it's the most important part of the body to take care of are your teeth.
Agreed. Why then is it so overlooked? It's just this routine thing we do every 6 months. We get our teeth cleaned. And if they find trouble, then they fix it. Or if something is troubling you, then you run to the dentist.
Correct.
But you're speaking of something much deeper than that.
Absolutely. I mean, you were the one who said, if your doctor is so smart, why are you still sick? Something like that.
Yes, I said it.
Yes, absolutely.
Hmm.
Your doctor is supposed to keep you healthy,
Yes.
not just take care of problems once they have already occurred.
Uh-oh.
So that really is the juxt of the problem. Doctors, I mean, I hate to be this much of a pessimist,
Mm.
but I really believe that being a doctor in this country and being a dentist in this country, for so many, a very high percentage of the doctors, it really is all about making money.
Yes.
And so
Agree.
when people come into the office and you go to your doctor for help, they're seeing you as a potential income maker for that day.
Uh-oh.
So it's more about what can I do for this person and be justified in any way, shape, or form, be justified and make a little bit more money that day. It's not all about what's best for this patient. What do they really need? It's not what you need, it's what the doctor needs. And
Uh-oh.
so I don't want to give my age away, but I've been in dentistry since I was 19.
Wow.
So that is over 50 years.
Blessed.
So I'm in an unusual position in that I've seen dentistry change
Yes.
over a 50-year period. And I saw it with my eyes open and I said, wow, there's something drastically wrong here.
Mm-hmm.
In the beginning, you went to the dentist because you had a cavity. That's
Yes.
still a problem because they didn't teach you how to keep from getting cavities. You went to the dentist when you had a cavity. If the cavity was big enough, the dentist would take the tooth out. Or some of them would say you need a root canal. That's the funniest thing in the whole world. You
Oh,
need
we have to
a
talk
root
about
canal.
that.
I love the word need. I could talk about the word need for days. So in those days, you went to the dentist for a filling or an extraction. And if you were in a upper well-to-do neighborhood, maybe you got a root canal and a crown.
Mm.
Those were the things you went to the dentist for. That's what the dentist did. And the dentist got paid most of the time cash. And they were all very happy. All of a sudden, this thing called dental insurance came into the picture.
Yes.
This is 1969. And we thought, well, what is dental insurance? Well, this patient works for a company that's going to give her or him $1,000 worth of dental care.
Mm-hmm.
The insurance company is going to cover it. Well, that sounded like a terrific idea back in 1969. And it really sounded, well, this is wonderful. People are actually going to get the care that they need.
Okay.
No, what happened very quickly is the dentist started to figure out what the insurance companies were paying for. So in other words, the insurance company didn't just say, go to the dentist, have your dentist send us the bill and we'll cover it. That would be true insurance.
Okay.
True insurance. My house burned down. They have to give me money for a new house. That's insurance. True insurance. My car just got totaled.
Yeah.
I need money for a new car. That's insurance. Even health insurance. I need an operation. It's $80,000. They pay for that for the most part.
Yes.
Maybe you pay a small part, right? But in dentistry, it was always just a stipend, a small stipend of $1,000. Because even back in 1969,
Mm-hmm.
$1,000 would not pay for a full mouth of dentistry, not at all. So what dentists started to see was, okay, what will they pay for? Okay, well, they're paying for a 6-month checkup.
Mm-hmm.
That's a funny story. I'll tell you, if you want to hear in a minute, I'll tell you how that 6-month checkup
Please.
There used to be a radio show on the radio every Saturday called Amos and Andy.
Yes.
Many of us didn't even have TVs, even 19. I was born in 1950. So in the early 50s, we did not have a TV. We had a radio. That was it. And so in the radio program, there was always a commercial break. The commercials were commercials for Pepsodent toothpaste.
Yes.
Because Pepsodent was the sponsor for the radio show. And they used to sing this little jingle. Now I'm really going to scare your listeners away. You'll wonder where the yellow went when you brush your teeth with Pepsodent. A lot of people our age all know that song. You'll wonder where the yellow went when you brush your teeth with Pepsodent. And after the commercial, Amos says to Andy, hey, Andy, just how often should you go to the dentist? And Andy said, oh, I don't know. I guess about every 6 months. And that was it. It became gospel.
Here.
That is where it got started.
What?
Every 6 months, because Amos and Andy said so.
What you are saying here is frightening, because you're saying that the dentists have figured out how to look at insurance to figure out what they could get paid for so they could get paid.
Correct.
That's very sinister.
Sure. So if your insurance pays for cleaning, you will get a cleaning whether you need it or not. I'm probably the only dentist on the planet that has actually dismissed patients from my office, looked in their mouth and said, so why are you here? They said, I need a cleaning. I said, really? Why do you need a cleaning? Well, it's been 6 months. Here's the holy 6 months. It's been 6 months since my last cleaning. And I said, okay, let me look in your mouth. I said, but I don't see any plaque. I don't see any calculus, tartar. I see nothing. So have a nice day. Thanks for stopping in, by the way.
Wow.
I've done that several times. And my patients, I can see they walk out of the office with this perplexed look on their face.
Absolutely.
This dentist is telling me to go home because I'm doing a great job of, number one, eating correctly.
Yes.
And number two, keeping my mouth perfectly clean at all times.
Okay. And if during that cleaning they discover a little thing called a cavity, why should one be concerned about the silver mercury fillings?
Well, they should be very concerned if the dentist even suggests putting a silver mercury amalgam filling in their mouth, because most people are not told that mercury amalgam fillings are toxic.
That's right.
Matter of fact, you notice I'm calling them mercury amalgam fillings. Most people think they're silver fillings. Anita and I had the privilege of speaking at a conference in Rhode Island a few years ago, filled with PhDs. Those are doctors of philosophy that teach at universities and research mercury. The title of the conference was Global Study of Mercury in the Earth. Okay. So we had all these PhDs. These are very bright people. I was the only dentist there. They would come up to my booth and say, what's this all about? Why are you here? I said, well, it's a conference on mercury. And since mercury is the number one problem coming out of people's mouths, I thought you should know. They go, oh, but I don't have any mercury fillings. These are silver. I can't tell you how many PhDs. These are smart people who study mercury. They actually put drops of mercury in the cage to the rats and see how the rats respond to that amount of mercury in their drinking water. They know all about mercury and its effect on rats. And they didn't even know that they had mercury in their own mouth, outgassing 24 hours a day, 7 days a week.
Yes.
In their own mouth and affecting the way they think.
Oh, okay.
The least of it.
Okay, you cannot skip over that part. Affecting the way they think.
Correct.
Tell us about that.
Well, this is another Huggins statement. He would say to us, if you have mercury fillings in your mouth, you don't even know who you are. Because you don't even know who you are, because the mercury outgasses from the teeth. It literally comes off the surface of the teeth. It goes through the palate, enters into the brain, and it changes the way you think. And if the mercury gets locked into the brain, then whatever thought pattern you had at that moment, the day the filling was put in, that thought pattern also gets locked into the brain. So you're not thinking the way God designed you to be thinking. You're thinking as someone who has mercury locked into their brain. Now, in the old days, when we used to take out mercury fillings one section at a time, we would always, we didn't have conscious sedation back then. We would just do one section, the section with the highest mercury filling, the highest amount of electricity in it. And then we would call the patients that night to see, how are you doing? And many of them would report that evening or the next morning, they would say, oh my gosh, I thought of something that I hadn't thought of in 20 years.
Really?
Just suddenly came to my mind. It's amazing that is because the filling with the highest negative charge was removed first, which is part of the Havoc protocol. We have to do that.
Now, I have heard for years how dangerous mercury fillings are. Never, ever have I heard it articulated in this way, of it trapping the thought at the moment and affecting the brain. That is a brilliant discovery.
Mm-hmm. That's the very first thing that happens. The list is endless. The absolute list is endless. Now, when I had my mercury fillings removed in January of 1993, maybe I should tell that story.
Yes, please.
All right. A patient gave me an article to read about mercury.
Mm-hmm.
I'll try to give you the short version here. She gave me this article to read, and she said, would you be open-minded? And I said, of course I would be. I read the article. I was blown away. It was written by Dr. Sandra Denton, who was an MD working for Dr. Huggins at the time.
Mm-hmm.
The article talked about how mercury affects you mentally, hormonally, physically, every metabolism, your digestion, you on and on and on. Every organ system you could think of was affected by the mercury in somebody's mouth. What was interesting about that article was that there wasn't a single article written that contributed to this. There wasn't a single bibliography by a dentist. There were psychologists, psychiatrists, cardiologists, biochemists, physiologists, you name it. Every profession you could think of, but no dentist. I thought, well, wait a minute, maybe this is bogus. So I took the article to the local library. There's a medical library in Scranton. And I said, you know what, could you check this to see if it's bogus? And she, yeah, sure, Dr. Grube. She calls me up the next day and she says, hi, I have your articles for you. What articles? She goes, well, the articles you asked me to look up. I said, well, I just wanted to know if they were bogus. She said, well, it was very interesting. I thought you would want to read this. Okay, so she gives me a stack of articles to read about this. Mm-hmm. And I was really blown away.
Yes.
I called up Dr. Hal Huggins and I said, listen, I need to learn about mercury toxicity. And his worker said, okay, you need to come out to Colorado. Well, come on. I have 3 children, 2 cats, a husband, a dental practice, maybe not necessarily in that order, but I'm not going to Colorado. No way. And he said, yeah, well, you did say you wanted to learn about mercury toxicity. I said, yeah. Can you send me a book? And he said, absolutely, I will send you a book, but you still need to come out to Colorado. Okay, the book that he sent me was this one. It's All in Your Head. This is the book that was written by Dr. Hal Huggins in 1984, blew the lid off the whole mercury issue. He's the one who told everybody, hey, guess what? There's mercury in your mouth coming off every single day. So that was the book that he sent me. Very interesting reading. When I got to Colorado, Dr. Huggins drew blood from every dentist as they walked into the room. You sat down before you got a chance to pick your seat. They slapped a tourniquet on your arm and drew about 4 or 5 vials of blood. And I thought, oh, my Lord, I have joined a cult. What is this? What's going on? Dr. Huggins spent 3 days talking about mercury, mercury, mercury. On the 4th day, he said, well, today your blood tests are coming back from Colorado Springs General Hospital, and I'm going to show you all how sick you all are. That's interesting. And so, of course, my blood chemistry went up first. This is the old days, so it was an overhead projector. And he said to me, Blanche, how long have you had cancer? I said, really? Where do you see that? He said, well, they circled it in red several times. And I looked, and sure enough, I saw something circled in red. And I said, well, it says 1% meta. What is that? Oh, those are metablastic cells. Those are cancer cells.
Wow.
I said, well, 1% is a small number. I'm always the optimist. I said, well, 1% is a small number. He said, really? Well, 2%, 1% you're sick, 2% you're in the hospital, and 3% you're dead.
Wow. Okay, Dr. Huggins.
Okay, so that was my introduction to biological dentistry.
Interesting.
And it took me several months before I realized this man is speaking truth.
Mm-hmm.
And so that was in September of 92. In January of 93, I always say I put myself in the hospital. I put myself in the Huggins Clinic. And I was treatment planned to have 18 mercury fillings removed and 5 root canal teeth taken out. Okay, which was a lot for a dentist because I never thought I would ever have a tooth taken out. So when they removed my fillings, they removed the section that had the highest negative charge first. And for me, that was my upper left.
Okay.
All of those fillings came out. I went back to my hotel room to relax and enjoy the day. The next morning, I woke up and I could read for the first time in my life. There was a silence that I had never experienced because I got my first filling when I was 4 years old in the Sunset Park Dental Clinic in Brooklyn, New York. And I'd had fillings since then. Who knows if I ever even needed them. But that's where I got my first filling. I always had this droning in the back of my head. In 3rd grade, I was put in remedial reading because I could not read a sentence without going back to the beginning again. I couldn't read a paragraph with any comprehension whatsoever. So
Yeah,
you may be wondering now, how the heck did this lady get into college?
And become a doctor.
Yeah, well, I took the English placement test and failed it. And the instructor came up to me and she said, well, why don't you take the Evelyn Wood reading course? She'll teach you how to follow your finger. Okay, I took the Evelyn Wood reading course. I could follow my finger. I still didn't know what I was reading. I took the English placement test again and I failed it again. And she suggested I take the Evelyn Wood reading course again. Okay, I took the course a second time. Well, this is interesting. Finally, the 3rd time I took the test, she felt sorry for me. Thank God this woman had compassion. She said, listen, I understand you're a music major. I said, that is correct. I play the flute. Okay, so you're going to be mostly in the music department the whole time you're here, right? I said, yep, that is correct. She said, well, you failed the test by 1 point. I'm going to give you that 1 point. That's how I got into college.
Oh, bless her.
That is how I got into
the bush, huh?
No kidding. A little bit of a push from somebody else who was fulfilling God's will. No kidding.
About that, a ram in the bush.
Yeah. So, but that's why I became a musician, because I couldn't read. Oh. Musicians don't read. They look at music vertically. Chords, right? And we practice everything ahead of time, so it's not like we have to read something, right? So
I don't know
here
about
I am now. Let's fast forward to 1993. I just had one section of mercury fillings removed. And all of a sudden, there's a quiet in my head I had never experienced. I grabbed the magazine and I used my finger. Wow. I read the whole paragraph. I understood everything that I had just read. I was so excited. I could not wait for Dr. Huggins, to show up in the clinic that morning. And when he did, I ran up to him and I said, Dr. Huggins, guess what? He said, what, Blanche? I said, I can read. He started laughing. He goes, of course you can read. I said, no, you don't understand. I can read. I couldn't read before, but now I can. I said, you know what? I don't care if my cancer doesn't go away. I'm going to spend the last 3 months of my life reading.
Yes.
And he said, oh, don't be silly. Your cancer is going to go away too. He knew that. And so the 3rd week of my treatment, after I had all my mercury fillings removed, they removed the root canal teeth and my leukemia disappeared that Friday afternoon. And I thought,
all right, wait, pause.
Okay.
Say more. The removal of the teeth helped the cancer to disappear? Or did you
dead teeth? These are not any teeth, dead teeth.
The root canal teeth.
These are root canal teeth.
Because there's always a focal infection where there's a dead tooth.
So these are root canal teeth that my body was trying to eliminate and get rid of for who knows how many years.
Sure.
Okay? The immune system, I keep telling people, the immune system is an obligatory system. Mm-hmm. If it sees something that is toxic, that is eventually going to kill us, it is obligated to try and get rid of it.
Yes,
So your white blood cells are a finite system,
they are.
meaning when you're born, as women, for instance, when we're born, we have just so many eggs and that's it. We don't have any more after that. It's a finite system.
Yes.
Men have as many sperm as they can continue making into old age. So
Mhm.
there is a difference between the two. Our immune system is a finite system.
Yep.
The day you're born, you're given so many copies of good white blood cells.
True.
It's very much like the day that you need to call in for a new copying machine in your office, and the salesman comes in and he says, "Wow, this copying machine is going to give you 1,000,000 copies." And you think, "Oh my Lord, that's just wonderful. 1,000,000 copies. That's great." And before you know it, you're up to 999,999 copies.
Mm-hmm.
Now, will your copying machine continue to make copies? Yes, it will. But those copies are not so good.
Yes.
They're fuzzy. You get some scratches. They're not so good. Our immune system is the same way. We're given so many copies of white blood cells. So if you have a lot of infections and you keep making more and more white blood cells, eventually you're going to run out of good copies.
Mm.
You will continue making copies, but they're not
Yes.
going to be smart copies.
Yes.
They're not going to be good copies. This is why grandma goes into the hospital. She looks like she's okay. She's got a white blood cell count of 5.5,
Mm.
and she dies of pneumonia the next day. Why is that? Well, because grandma was making white blood cells, but they were not good white blood
That's
cells.
right.
She used them all up when she was younger with some sort of continual infection that nobody was able to take care of.
That's right.
Okay. So that's when it's not that the root canal tooth causes cancer directly,
Mm-hmm.
but the root canal tooth is such a strain on the immune system that
Yes.
when cancer does come down the pike, you have nothing left to fight
It's
it.
defenseless. Yes, your body is
You are
defenseless against that.
defenseless. When the cancer cell shows up in a woman's right breast, and those beautiful macrophages, they see it,
Yeah.
they immediately call up the president of Spring University. They say, "Listen, we need 100,000 natural killer cells to the right breast immediately. There's a couple of cancer cells down here multiplying." And the president of Spring University will say, "Excuse me, did you say you wanted 100,000 white blood cells to the right breast? I'm sorry. You know that root canal that we've been fighting? The bicuspid on the upper right? Why? Because the bicuspid is energetically connected to the breast.
Yes.
So, you know that root canal we've been fighting? We're losing 100,000 white blood cells every day.
Mm.
I'm sorry. I can't give you what you need. Suppose I give you 10,000 white blood cells. Oh, I know what I'll do. I'll give you another 10,000 uneducated cells. They're larger than they should be. I know. They look good. They don't know what they're doing. We'll just send those." And so that's why when I look at a blood chemistry, I can tell immediately if a patient has potential cancer in their body.
Yes.
Because you see a depressed white blood cell count,
That's
and you
right.
see an elevated mean corpuscular volume, which means their white blood cells are large. They're stupid. They don't know what they're doing. When you see those two numbers, that person's in trouble.
Yes. And you can guarantee that they have a root canal on that side of the body.
Yes. Now, Dr. Huggins challenged all 60 dentists in the class, and he said, if any of you can find a patient with cancer that does not have a root canal or a cavitation, that's where a tooth was taken out and the socket never healed, so it's just like a root canal. If any of you find a patient with cancer who does not have a root canal or a cavitation, I'll give you $1,000.
Wow.
Ooh, I had that money spent 6 ways to Sunday. You're on, baby.
Yes, and
Bring it on. I'm going to look.
He was that sure. He was that
He was
certain
that
of
sure.
himself.
He was that sure. And in 28 years, And I don't know how many patients I've had with breast cancer come through my office. Not a one.
Speaking
Not
of
one. Did
speaking of
not have a root canal or cavitation.
cavitation, isn't that something? Speaking of your office, I have one last question for you.
Mhm.
How were you received by your patients, by the community, when you made this switch from general dentistry to holistic dentistry?
Oh, that's an easy question to answer because I had to close my practice. When I came back from Colorado Springs, I closed my practice. My husband asked me, "What are you doing?" I said, "I can never put another mercury filling in somebody's mouth." And he said, "Okay, so do something else." That's a problem because they didn't teach us how to do something else in dental school. All I knew how to do was mercury fillings back then. So when I did get back into practice about 3 weeks later, I let my patients know that I would not be putting in mercury fillings anymore, that I would be doing the composites. And more than half of them said bye-bye.
Wow.
Yeah,
Interesting.
more than half of them said bye-bye, but it was just something that I knew I had to stand by.
That's correct. And you have since then taken on this mantle to educate us about the dangers of mercury fillings. That's just the tip of the iceberg. And we know that we'll have you back to
Thank you.
continue this conversation because it is far too important to let it just go by the wayside. Just as something as simple as educating the public and the viewers on fluoridated toothpaste and the warning label.
Everything. That is my passion in life, is to educate people and know that just because your dentist said you need such and such, fill in the blank, doesn't mean you need such and such. Hal Huggins wrote his book, It's All in Your Head, in 1984. I just published my book, Chew on This, but Don't Swallow. Don't eat and swallow everything that your dentist tells you. Get a second opinion. Educate yourself and decide what's best for yourself. Of course, that requires taking responsibility for your health.
How about it? That's what I say all the time. It starts with your single responsibility to your own health, and you don't need anyone's permission to engage in that responsibility. Dr. Blanch, you are a treasure, a joy, and now, if you don't mind, we'd like to call you amongst our collective of good doctors.
Good, thank you. Oh, honored.
Yes, and we will have you back once again. So thank you very much for joining us today.
Thank you. Thank you for having me. I can't wait for the next talk.
Me either. Looking forward to it. And thank all of you for joining us. I'm Dr. LaJoyce Brookshire. Join us next time on Ask the Good Doctor. And remember to let your eyes shine, cut back on the wine, get good food fast, and go easy on the greasy. Until next time, I'm here to help you attain and maintain your perfect health. Let's do it again next week, okay? God bless you. In Atlanta, doing a Kitchen Warriors right in your backyard. We're going to... Yes, if it's all ready, you can show it to us now. If you are in the Atlanta area, click down below.